Hi, my name is Brianna Contreras, and I'm Associate Editor of Managed Healthcare Executive.
Hi, my name is Peter Werwine, and I am Senior Editor of Managed Healthcare Executive.
We are very excited to be sharing a video spotlighting individuals selected for Managed Healthcare Executives' annual 10 Emerging Industry Leaders in Healthcare feature. This is our 4th annual feature, which is shared in our October 2020 issue. We ID candidates by nomination and independent research to identify 30 finalists, and then we window that list down to 10.
And the criteria we use for both the finalists and our final 10 is we look for people who have launched some key initiative, who have had an impact on healthcare, who have taken on increased responsibilities both in their current position and maybe in some past positions. In short, we look for leaders. And then to satisfy the emerging part of 10 emerging healthcare industry leaders, we limit our list to people who have worked in the industry, to folks who have been in it for no more than 15 years.
This is one of our favorite features of the year, where we meet great people to speak with and who belong to a range of fields in healthcare. We hope you enjoy the short video.
I grew up a son of immigrants. Both my parents are from Jalisco, Mexico. And as immigrants, they never had the opportunity to get an education. And so education was not only important in my family because this was an opportunity for myself and my siblings. But it was also a way for me to be someone who could translate what happens here in the United States to my parents. And as I saw them work through plenty of applications, especially those in healthcare when they were seeking care, I saw that there was a real need, both to better care for them, but also that many of those in my community really did reflect who my parents were, which is individuals who may not speak the language, English as a first language, and or come from all places in terms of background, in terms of places across the globe. And that was really my early experiences as an immigrant, as a son of immigrants, and being able to go to college and volunteer. One of the first experiences was volunteering and being an interpreter for health professionals and at a free health fair. And that really is what shaped the rest of my life because I saw that I could combine my own education to giving back and serving my community. COVID-19 for us was a real wake-up call around not only the existing inequities that our patients suffer from here in Southern California, but more importantly, that it exacerbated those inequities. And so we found ourselves early on as a health system here without any access to COVID-19 testing. Our communities and where we're located are some of the most underserved communities. And while there was no cases, it was because there wasn't enough COVID-19 testing. So as soon as we started to test, we rapidly mobilized our entire workforce. We set up over a dozen testing centers and have tested close to 60,000 people since March. And our positivity rates in terms of where we serve were upwards of 20%, and compared to the county, which was closer to 6-8%. And again, this is at the surge, at the peak of where we were surging here in Southern California. But it gives you a real good sense of how much need there is in our communities, but more importantly, how impacted our communities have been. And so we've had to transform our ability to care for these communities, not only by responding to COVID-19, but also thinking about how do we better serve them using telehealth and reach these communities so that they don't defer important preventative and chronic disease care. We serving primarily underserved community, Black and Brown communities here in Southern California. Our history, we're well aware of racism. We were founded because of the civil rights movement as a community health center. And thanks to so many leaders who stood up to racism and the fact that we wanted to build a community health center specifically to serve those who were discriminated or disenfranchised. And so for us, again, to be able to now be part of the national conversation around how we've set up a community health center with the mission to eliminate disparities, where we call out specifically that we stand up against racism, and be able to share our community health center as a best practice in terms of a model, I think has been very empowering for us as a healthcare workforce and those, but also for our community. I think that our patients have shared with us how much they trust us during these very stressful times. We're often the place they go to for support, not just medical, but social support. And we are connecting constantly, we are constantly connecting our patients with social services so that they can overcome and really so that they can overcome this pandemic. I would say that, yeah, this COVID-19 pandemic for me personally has been a real challenge. I really enjoy the social connectedness with people. But, I've really learned to not only appreciate like playing hide and seek with my children, but being able to go back to some of the games that maybe were unappreciated before, because we just took a lot of things for granted. And also, yeah, that's probably another thing is being able to really appreciate the company of my wife and my kids, because they're really my bubble, right? They're within the bubble, and I can feel very comfortable around them. And so that I think has been a real win. Many times we're known in healthcare to spend too much time working, or, really not spending enough time with our families. And so I think it's although although this pandemic has presented challenges, it's also brought us back to how important it is to stay connected, but more importantly, how valuable our families are in overcoming this pandemic.